Chapter 32, Oral Medications, Med-Surg, TIMBY. Learning Objectives. Define medication. Name 7 components of a drug order. Explain the difference between trade and generic drug names. Name 4 common routes for medication administration. Describe the oral route and 2 general forms of medication administered this way. Explain the purpose of a medication record. Name 3 ways that drugs are supplied. Discuss 2 nursing responsibilities that apply to the administration of opioids. Name the 5 rights of medication administration. Give the formula for calculating a drug dose. Discuss at least 1 guideline that applies to the site and safe administration of medications. Discuss 1 point to stress when teaching clients about taking medications. Explain the circumstances involved in giving oral medications by an enteral tube and 1 commonly associated problem. Describe 3 appropriate actions in the event of a medication error. Is the following statement true or false? An advanced practice nurse can write a medication order. The answer is true. An advanced practice nurse can write a medication order if legally designated to do so by state statutes. One of the nurse's most important responsibilities is the administration of medications, chemical substances that change body function. This chapter emphasizes the safe preparation and administration of medications, particularly those given by the oral route. This chapter uses the term medications and drugs synonymously. Information on specific drugs can be found in pharmacology texts or in drug reference manuals. Medication orders. A medication order lists the drug name and directions for its administration. Usually, physicians or dentists provide medication orders either written or signed electronically via a secured computer program. Other healthcare providers, such as a physician's assistant or an advanced practice nurse, can also provide medication orders if legally designated to do so by state statutes. Medication orders in the client's medical record are used here for the purpose of discussion. Components of a medication order. All medication orders must have 7 components: the client's name, the date and time the order is written, the drug name, the dose to be administered, the route of administration, the frequency of administration, the signature of the person ordering the drug. If any one of these components is absent, the nurse must withhold administering the drug until he or she has obtained the missing information. Medication errors are serious. Nurses never implement a questionable medication order until after consulting with the person who has written the order. A nurse is legally responsible for ensuring that all components of a medication order are present and correct before administering any drug. If there's any question in the nurse's mind about the order as it is written, whether it be misleading or difficult to understand, the nurse must get clarification from the person who wrote the order. Remember, the client's safety is the primary concern. Drug name. Most drugs have a trade name, the name by which a pharmaceutical company identifies its drug. A trade name is sometimes called a brand or proprietary name. A drug's trade name is generally capitalized and followed by a large R within a circle, as in R with a circle. Drugs also have generic names, a chemical name not protected by a company's trademark, which is written in lowercase letters. For example, Demerol is a trade name used by Winthrop Pharmaceuticals for the generically named drug meperidine hydrochloride. The NCLEX examination is using generic names and omitting trade names in the current test plan. Look-alike and sound-alike drugs. Physicians, nurses, and pharmacists must be aware that there are many look-alike and sound-alike drug names. The Joint Commission's Medication Management Standards, effective since 2014, requires hospitals to develop a list of look-alike, sound-alike medications it stores, dispenses, or administers, in an effort to promote the safe administration of medications. The Institute for Safe Medication Practices, as of 2015, provides a list of confused drug names that is available as a resource. See the examples in box 32-1, page 760. Everyone involved in prescribing and administering medications should refer to a compiled list. The list should be updated at least yearly. Avoiding abbreviations for drug names such as MS for morphine sulfate and indicating the purpose for the drug with the medication order also may help avoid any misinterpretation. For example, a prescription for Lunesta written for sleep would not be confused with Neulasta, which is prescribed to increase a client's white blood cell count. Some agencies have a policy that only the generic name can be prescribed or that the prescription include the generic name and the trade name. Drug dose. The dose means the amount of drug to administer and is prescribed using the metric system. Some drugs are also prescribed in units, milliunits, international units, and milliequivalents, abbreviated small m, large e, small q, a unique measurement primarily used for chemical compounds such as potassium chloride. For the purposes of safety, the ISMP indicates that apothecary measurements, an antiquated system of drug dosing, are now subject to exclusion. This safety measure was brought about because apothecary abbreviations were frequently misread, misinterpreted, and confused with metric system abbreviations. The ISMP has also identified additional error-prone abbreviations, symbols, and dose designations on their website. Refer to Table 32-1 for the Joint Commission's Do Not Use abbreviations in prescribing medications. For home use, drug dosages are converted to household measurements that are more easily interpreted by non-professionals. Route of administration. The route of administration means how a drug is given, which may be oral, topical, inhalant, or parenteral route. Topical and inhalant routes of administration are discussed in Chapter 33. Parenteral administration is described in Chapters 34 and 35. Oral route. The oral route, the administration of drugs by swallowing or instillation through an enteral tube, facilitates drug absorption through the GI tract. It is the most common route for medication administration because it is safer, more economical, and more comfortable than others. Medications administered by the oral route come in both solid and liquid forms. Solid medications include tablets and capsules. A scored tablet, a solid drug manufactured with a groove in the center, is convenient when only one part of a tablet is needed. Enteric-coated tablets, a solid drug covered with a substance that dissolves beyond the stomach, are manufactured for drugs that cause irritation of the stomach. Enteric-coated tablets are never cut, crushed, or chewed because when the integrity of the coating is impaired, the drug dissolves prematurely in gastric secretions. Some tablets and capsules may be identified as sustained release, capital S, capital R, sustained action, capital S, capital A, extended release, capital E, capital R, capital X, capital R, or capital X, capital L, or similar abbreviations like continuous release, which is capital C, capital R, which indicates that the drug is designed to dissolve slowly and be released over time. A drug compounded as such can be taken less frequently and maintain a steadier drug level when in the blood. Sustained, extended, and continuous release medications are never crushed. Doing so affects the rate of drug absorption. Liquid forms of oral drugs include syrups, elixirs, and suspensions. Nurses measure and administer liquid medications in calibrated cups, droppers, or syringes, or with a dosing spoon. See Figure 32.1 on page 761. Polypharmacy, the administration of 4 or more medications to the same person, increases the risk for drug interactions and adverse reactions. Almost 50% of people over 65 take 5 or more medications weekly. This can lead to drug interactions that are hard to identify due to the number of drugs, which could be the problematic cause. Therefore, medication reconciliation should be done any time an unanticipated change in a client's status is observed. Effects of reduced organ function on drugs. There are a number of pharmacokinetic changes that may result from the reduced function of different organs in the body, such as the kidney and liver. Frequency of administration. The frequency of drug administration refers to how often and how regularly the medication is to be given. Frequency of administration is written using standard abbreviations of Latin origin. Some common examples include the following. STAT, S-T-A-T, means immediately. BID, in small caps, is twice a day. TID is 3 times a day. QID is 4 times a day. QH is hourly. Q4H is every 4 hours. PRN means as needed. When the medication order is implemented, drug administration is scheduled according to the prescribed frequency. The health agency sets a predetermined timetable for drug administrations. Hours of administration may vary among agencies. For example, if a physician orders QID 4 times a day administration of a medication, it may be scheduled for administration at 8 a.m., noon, 4 p.m., and 8 p.m. Or at 10 a.m., 2 p.m., 6 p.m., and 10 p.m., or at 6 a.m., noon, 6 p.m., and midnight. To simplify a complex medication regimen, a number of drugs consistently prescribed together are made in combination form. An example is Namzaric, which combines memantine and donepezil, 2 drugs used to treat Alzheimer's disease. This can reduce administration of 3 pills daily to 1 pill a day. Verbal and telephone orders. Verbal orders are instructions for client care that are given during face-to-face conversations. Telephone orders are obtained from a physician during a telephone conversation. Both types of orders are more likely to result in misinterpretation than are written orders. However, there are circumstances when verbal and telephone orders are justified, such as when a physician or provider is involved in a procedure he or she cannot leave, when a physician or provider is managing the urgent care of another client, when a computerized provider order system, abbreviated CPOE, is unavailable or the physician or provider is unable to access it, when a delay in obtaining an order would cause harm to a client or result in a negative outcome, when an order is urgently needed in less time than it would take to arrive at the agency or across a computerized provider order system, such as when driving in traffic. If a prescriber is physically present, it is appropriate to ask tactfully that the order be handwritten. See Nursing Guidelines 32-1 on page 762. Documenting the medication administration record. Once the nurse has obtained the medication order, he or she transcribes it to the medication administration record. This is abbreviated MAR in capitals. This means the agency formed to document drug administration. Use of the MAR ensures timely and safe medication administration. Some agencies use a form on which nurses transcribe the order by hand, others use a computer-generated form. Regardless of the type, all MARs provide a space for documenting when a drug is given, along with a place for the signature, title, and initials of each nurse who administers a medication, or documenting the nurse who administers the medication automatically when barcodes are scanned electronically. The current MAR is usually kept separate from the client's medical record, but it eventually becomes a permanent part of it. The standard abbreviation for writing twice a day is QD, QOD, BID, or TID. Again, the standard abbreviation for writing twice a day is? The answer is BID. The standard abbreviation for writing twice a day is BID. QD stands for every day, QOD for every other day, and TID for 3 times a day. Oral route. The oral route, the administration of drugs by swallowing or instillation through an enteral tube, facilitates drug absorption through the GI tract. It is the most common route for medication administration because it is safer, more economical, and more comfortable than others. Medications administered by the oral route come in both solid and liquid forms. Solid medications include tablets and capsules. A scored tablet, a solid drug manufactured with a groove in the center, is convenient when only part of a tablet is needed. Enteric-coated tablets, a solid drug covered with a substance that dissolves beyond the stomach, are manufactured for drugs that cause irritation of the stomach. Enteric-coated tablets are never cut, crushed, or chewed, because when the integrity of the coating is impaired, the drug dissolves prematurely in gastric secretions. Some tablets and capsules may be identified as sustained release, SR, sustained action, SA, extended release, ER, XR, or XL, or similar abbreviations like continuous release, CR, which indicates that the drug is designed to dissolve slowly and be released over time. A drug compounded as such can be taken less frequently and maintain a steadier drug level when in the blood. Sustained, extended, and continuous release medications are never crushed. Doing so affects the rate of drug absorption. Liquid forms of oral drugs include syrups, elixirs, and suspensions. Liquid forms of oral drugs include syrups, elixirs, and suspensions. Nurses measure and administer liquid medications in calibrated cups, droppers, or syringes, or with a dosing spoon. See page 761, figure 32-1. Question: which of the following is the most common route to administer medication? Oral, topical, inhalant, parenteral. The answer is oral. The oral route is the most common route to administer medication. The topical route is used for skin application, inhalant for aerosols, and parenteral for injection. Polypharmacy is the administration of 4 or more medications to the same person, increases the risk for drug interactions and adverse reactions. Almost 50% of people over 65 take 5 or more medications weekly. This can lead to drug interactions that are hard to identify due to the number of drugs, which could be the problem. Therefore, medication reconciliation should be done anytime an unanticipated change in a client's status is observed. Frequency of administration. The frequency of drug administration refers to how often and how regularly the medication is to be given. Frequency of administration is written using standard abbreviations of Latin origin. Some common examples include the following. STAT means immediately, BID twice a day, TID 3 times a day, QID 4 times a day, QH hourly, Q4H every 4 hours, and PRN as needed. When the medication order is implemented, drug administration is scheduled according to the prescribed frequency. The health agency sets a predetermined timetable for drug administration. Hours of administration may vary among agencies. For example, if a physician orders QID 4 times a day administration of a medicine, it may be scheduled for administration at 8 a.m., noon, 4 p.m., and 8 p.m., or at 10 a.m., 2 p.m., 6 p.m., and 10 p.m., or at 6 a.m., noon, 6 p.m., and midnight. To simplify a complex medication regime, a number of drugs consistently prescribed together are made in combination form. An example is Namzaric, which combines memantine and donepezil, 2 drugs used to treat Alzheimer's disease. This can reduce administration of 3 pills daily to 1 pill daily. Verbal and telephone orders. Verbal orders are instructions for client care that are given during face-to-face conversations. Telephone orders are obtained from a physician during a telephone conversation. Both types of orders are more likely to result in misinterpretation than are written orders. However, there are circumstances when verbal and telephone orders are justified. When a physician or provider is involved in a procedure they cannot leave. When a physician or provider is managing the urgent care of another client. When a computerized provider order system, CPOE, is unavailable or the physician or provider is unable to access it. When a delay in obtaining an order would cause harm to a client or result in a negative outcome. When an order is urgently needed in less time than it would take to arrive at the agency or access a computer, such as when driving in traffic. If a prescriber is physically present, it is appropriate to ask tactfully that the order be handwritten. Obtaining telephone orders, Nursing Guidelines 32-1 on page 762. Always identify yourself, your agency, and unit on which you are working. This orients the provider as to who is requesting or receiving the medical order. Identify the client, the situation, the background, the circumstances, pertinent assessments, and recommendation, the SBAR technique. We use ISBAR, which starts with identification. Concerning care. SBAR is the Joint Commission's recommended practice for spoken communication among healthcare members. Verify the identity of the prescriber with a callback telephone number or a specific number on record at the agency. Verifying the prescriber's identity provides evidence that the order has reliably been obtained from the responsible provider or someone covering in his or her absence. Also have them spell their name, their last name especially. Have a second nurse listen simultaneously on an extension. A second nurse serves as a witness to the communication. Record the date and time with the drug order directly on the client's medical record as it is received. A written recording avoids errors in memory. Make sure the order includes the essential components. Doing so complies with standards for care. Clarify or spell drug names, especially those that sound similar, such as Celebrex and Cerebrex, or Nicobid and Nitrobid. Checking avoids medication errors. Spell or repeat numbers to avoid misinterpretation, such as 15, 15, and 50, 50. This step avoids medication errors. Read back the written information to the prescriber. Repetition clarifies understanding and accuracy. Use the abbreviation TO at the end of the order. This abbreviation indicates the order is a telephone order. Write the prescriber's name and co-sign with your name and title. These steps comply with legal standards and demonstrates accountability for the communication. Remind the prescriber that the order must be signed as soon as possible according to the agency's policy. This confirms responsibility for the order. Documentation in the medical administration record. Once the nurse has obtained the medication order, he or she transcribes it to the medication administration record, called the MAR. This is the agency form used to document drug administration. Use of the MAR ensures timely and safe medication administration. Some agencies use a form in which nurses transcribe the drug order by hand. Others use a computer-generated form. Regardless of the type, all MARs provide a space for documenting when a drug is given, along with a place for the signature, title, and initials of each nurse who administers the medication, or documenting the nurse who administers the medication automatically when barcodes are scanned electronically. The current MAR is usually kept separate from the client's medical record, but it eventually becomes a permanent part of it. Storing medications. Each health agency has one area for storing drugs. Some agencies keep medications in a mobile cart. Others store them in a medication room. Each client has a separate drawer or cubicle to hold his or her prescribed medications. Regardless of their location, the supply of medications remains locked until the drugs are given. Accounting for controlled substances. Controlled substances are drugs for which federal laws regulate their possession and administration. Health agencies keep controlled substances such as opioids in a double-locked drawer, a box, a room in the nursing unit, or an automated medication dispensing system. Because controlled substances are usually delivered by stock supply, nurses are responsible for an accurate account of their use. They keep a record of each drug used from the stock supply. Any controlled substance that is wasted in whole or in part must be co-signed by a witness. Nurses count controlled substances regularly, usually at each change of shift. One nurse counts the number in the supply while another checks the record of their administration or amounts that have been wasted. Both counts must agree, with inconsistencies accounted for as soon as possible. Methods of supplying medications. After transcribing the medication order to the MAR, the nurse requests the drug from the pharmacy with a paper, computer, or a fax transmission request. Drugs are supplied or dispensed in 3 major ways. An individual supply is a container with enough of the prescribed drug for several days or weeks, which is common in long-term care facilities such as nursing homes. A unit dose supply, a self-contained packet that holds 1 tablet or capsule, is most common in acute care hospitals that stock drugs for individual clients several times in one day. In long-term care facilities, single doses of drugs may be packaged in a multi-dose blister pack. A stock supply, large numbers of stored drugs, remains on the nursing unit for use in an emergency so that a nurse can give a drug without delay. Some facilities use automated medication dispensing systems. See Figure 32-5, page 764. These systems usually contain frequently used medications for that unit, any as-needed, called PRN, medications, controlled drugs, and emergency medications. The nurse accesses the system by using a personal password and then selects the appropriate choice from a computerized menu. This type of system automatically keeps a record of dispensed medications and records the password, username, and title. To avoid drug diversion, a term used by the U.S. Drug Enforcement Administration, the DEA, when referring to the theft or possession of drugs, usually controlled substances, prescribed for someone else, the user's password should never be shared with anyone. Storing medications. Each health agency has one area for storing drugs. Some agencies keep medications in a mobile cart, others store them in a medication room. Each client has a separate drawer or cubicle to hold his or her prescribed medications. Regardless of their location, the supply of medications must remain locked until the drugs are administered. Medication administration. Safety is the main concern in medication administration. Taking various precautions before, during, and after each administration reduces the potential for medication errors. Some precautions ensure the 5 rights of medication administration: calculating drug dosages accurately, preparing medications carefully, and recording their administration. Applying the 5 rights. To safeguard against medication errors, nurses follow the 5 rights of medication administration. Some nurses have added additional rights, such as the right documentation, the right response, and the right to refuse. Every rational adult client has the right to refuse medication. If this happens, the nurse indicates that the scheduled administration was omitted on the MAR, identifies the reason why he or she did not administer the drug, and reports the situation to the prescriber. In an effort to reduce medication errors, some hospitals are using a barcode medication administration system, a point-of-care software that verifies the name of the medication, the administration time, the dosage, the drug form, and the client for whom the drug is prescribed. That is, the 5 rights to ensure accuracy by scanning a barcode on the drug's unopened package and identification band on the client. See Figure 32-7 on page 765. The software also documents the name and title of the nurse who administers the medication by scanning a barcode on the nurse's employee badge. Calculating dosages. One of the major nursing responsibilities and one of the 5 rights is preparing the dose accurately. Preparing an accurate dose sometimes requires the nurse to convert doses within metric and household equivalents. Once the prescribed and supplied amounts are in the same measurements and system of measurement, the quantity for administration can be easily calculated using a standard formula. See Box 32-2, Nursing Guidelines on page 765. The drug calculation formula is desired over have times quantity. Desired dose goes on the top of the equation, dose on hand goes underneath, which is the supplied dose, times the quantity equals the amount to administer. For an example, the drug ordered tetracycline 500 milligrams is the desired dose by mouth QID. The dose supplied is 250 milligrams, dose on hand per 5 mLs. Calculation, 500 milligrams over 250 milligrams times 5 mLs equals 10 mils that you're going to give. See page 765. Administering oral medications. Nurses prepare and bring oral medications to the client in a paper or plastic cup. The nurse administers only those medications that he or she has personally prepared. Never administer medications prepared by another nurse. Once at the bedside, it is also important for the nurse to remain with the client while he or she takes the medicines. Preparing medications safely. Prepare medications under well-lit conditions. Work alone without interruptions and distractions. Check the label of the drug container 3 times. 1. When reaching for the medicine. 2. Just before placing the medicine into an administration cup. And 3. When returning the medication to the client's drawer. Avoid using medications from containers with a missing or obliterated label. Return medications with dubious or obscured labels to the pharmacy. Never transfer medications from one container to another. Check the expiration dates on liquid medications. Inspect the medication and reject any that appear to be decomposing. Gerontologic considerations. Older people who have had cerebrovascular accidents or strokes or who are experiencing middle to late stages of dementia may have dysphagia, which is impaired swallowing, spelled dysphagia. Speech therapists are helpful in evaluating dysphagia and recommending safe and effective methods of administering oral medications. Some older adults have diminished salivary gland secretions and develop xerostomia, which is dry mouth. Offering a sip of water before administering medications or mixing oral medications with some soft food, such as applesauce, may prevent medication from adhering to the tongue and thus facilitate administration. If a client is not on the unit at the time of medication administration, the nurse returns the medications to the medication cart or room. Leaving medications unattended may result in their loss or accidental ingestion by someone else. Many drugs are absorbed better from the GI tract when given before or 1 to 2 hours after meals. Be sure and check for appropriate timing of oral drug administration for the best absorption. Many opportunities exist for teaching when administering medications. Teaching is especially important before discharge because the client often receives prescriptions for oral medications. Providing health teaching helps to ensure that clients administer their own medication safely, follow instructions, and adhere to their medication regimen. Even clients who purchase over-the-counter medications, non-prescription drugs, may benefit from instruction. See Client and Family Teaching 32-1, page 766. The nurse teaches the client and the family as follows. Inform the prescriber of all other drugs that you are currently taking. Have prescriptions filled at the same pharmacy so that the pharmacist can spot any potential drug interactions. Consider asking for a new prescription to be partially filled. This provides an opportunity to evaluate the drug's effect and side effects before purchasing the full amount. Read and follow the label instructions carefully. Take the prescription medication for the full time that it has been prescribed. Check with the prescriber before combining non-prescription and prescription drugs. Dispose of old prescription drugs and outdated over-the-counter medications. They tend to disintegrate or change in potency. Consult with the prescriber if a drug does not relieve symptoms or causes additional discomfort. Ask the prescriber or pharmacist whether it is appropriate to take specific medications with food or on an empty stomach. Drink a liberal amount of water or other fluids each day to assist with the appropriate absorption and elimination of drugs. Do not take drugs prescribed for someone else, even if your symptoms are similar. Wear a medic alert tag if you are taking prescription drugs on a regular and long-term basis. Use a pill organizer if you have trouble remembering whether you took a medication. Gerontologic considerations. If an older person has difficulty comprehending information about medication routines, include a responsible person in the discharge instructions to ensure client safety. A referral for skilled nursing visits is appropriate for homebound older adults who need additional instructions about medication routines after discharge. Older people should be taught to carry a current list of all their medications, dosages, times of administration, and names of the prescribing provider. Should an older client be found wandering or unconscious in evaluation, for possible medication adverse effects can happen more quickly if such information is readily available. Older people should use eyeglasses or hearing aids as needed to optimize their learning conditions. Other important considerations for the teaching learning environment are adequate non-glare lighting and little, if any, background noise. An evaluation of comprehension may be best done by having the older person repeat instructions after they are provided. Reinforce verbal instructions with written instructions at the older person's reading level. A copier may be used to enlarge instructions for clients with visual impairments. Written instructions are particularly important for clients with hearing impairments. They provide a reference for older adults with difficulty recalling or comprehending information. In addition, written instructions serve as a point of reference for caregivers who may assist with medication administration. Older adults who have problems with manual dexterity or strength may request that pharmacists use easy-to-open caps on their prescription containers. Clients with visual impairments may benefit from methods of identifying their medication containers other than reading labels. Suggestions include using rubber bands or textured materials on certain containers or using bright colors to mark the labels. Many simple-to-use medication management systems, sometimes called pill organizers, are available. Often a family member is helpful in setting up weekly medication management systems. For example, a family member may set out the medications in specially designed containers weekly. This method enables others to monitor patterns and the adherence to the medication regime, and it may be especially helpful when working with older people experiencing memory impairments. Older adults with insurance coverage for prescriptions may find it easier and more economical to have the prescriptions filled every 3 months. It may also be more economical to purchase prescriptions by mail or internet if the insurance provider approves this option. Encourage older adults to ask their primary health care providers about prescribing generic forms of medication for cost savings. Administering oral medications by enteral tube. When a client cannot swallow oral medications, they can be instilled by enteral tube. Because the lumen of a tube is smaller than the esophagus, special techniques may be required to avoid obstruction. See Nursing Guidelines 32-3. Nurses use slightly different techniques for administering medications through an enteral tube used for nourishment than they do for tubes used for decompression, such as suctioning. After administering medications through an enteral tube used for decompression, the nurse clamps or plugs the tube for at least 30 minutes to prevent removing the drug before it leaves the stomach. This is for an NG tube. Nurses can give medications while a client is receiving tube feedings, but they instill the medications separately. They do not add the medications to the formula. This is done for 2 reasons. First, some drugs may physically interact with the components in the formula, causing it to curdle or otherwise change its consistency. Also, a slow infusion would alter the rate of absorption of the drug. Pharmacologic considerations. Medication in liquid form is preferred for enteral tube administration when possible because it is less likely to cause tube occlusion. 2 important safety points to remember. 1. Draw up drug solutions only in oral syringes to avoid the accidental parenteral administration of an oral preparation. 2. Never crush extended or timed-release medications for enteral tube administration. It could cause an overdose of the drug. Documentation. If the nurse is not using a barcode medication system that documents drug administration immediately and automatically, the nurse should document medication administration manually on the MAR, the client's chart, or both as soon as possible. Timely documentation prevents medication errors. If the nurse does not record the dose, another nurse may assume that the client has not received the medication and may give a second dose. If a nurse withholds a medication, he or she documents its omission according to agency policy. A common method of such documentation is to circle the time of administration and initial the entry. The nurse may document the reason for the omission in a comment section on the MAR or elsewhere in the client's medical record. Preparing medications for enteral tube administration. Use the liquid form of the drug whenever possible. Add 15 to 60 ml of water to thicken liquid medications. to thick liquid medications. Water dilutes the medication and helps instillation. Pulverized tablets with a mortar and pestle, except those that are enteric coated. Pulverizing creates small granules that may instill more readily. Open the shell of the capsule to release the powdered drug. Avoid crushing sustained release pellets. Mix each drug separately with at least 15 to 30 ml of water. Use warm water when mixing powdered drugs. Pierce the end of a sealed gelatin capsule and squeeze out the liquid medication or aspirate it with a needle and syringe. As an alternative, soak a soft gelatin capsule in 15 to 30 ml of warm water for approximately 1 hour. Soaking will dissolve the gelatin seal. Avoid administering bulk-forming laxatives through an enteral tube. Such laxatives could block the tube. Interrupt a tube feeding for 15 to 30 minutes before and after administration of a drug that should be given on an empty stomach. Doing so facilitates the drug's therapeutic action or its absorption. Clamp a nasogastric tube that is being used to suction gastric secretions for 30 minutes after administering medication. Keeping the tube temporarily clamped allows time for the medication to move beyond the stomach and be absorbed. Medication errors. Medication errors happen too often. When errors occur, whether it is a result of a prescriber's order, drug supplied by the pharmacy, or nursing drug administration, nurses have an ethical and legal responsibility to report the error to maintain the client's safety. As soon as an error is recognized, the nurse checks the client's condition, number one, and then reports the mistake to the prescriber and the supervising nurse immediately. Healthcare agencies have a form for reporting medication errors called an incident sheet or accident sheet. The incident sheet is neither a part of the client's permanent record, nor does the nurse make any reference in the chart to the fact that he or she has completed an incident sheet. The completed incident report is generally reviewed by the agency's Risk Management Committee. See Chapter 3. The purpose of the incident sheet is to understand the circumstances surrounding the error and prevent them in the future. It is not intended to accuse or blame the individual healthcare provider. The desired outcome is to ensure the safety of clients and identify ways to prevent a similar reoccurrence. However, if the same person makes repeated errors, the agency may recommend a period of retraining or supervision. Enteral tube. This is the process of giving oral medications by an enteral tube into the stomach. Circumstances under which oral medication can be given using an enteral tube has been covered. Nursing implications for diagnoses regarding administration of medications. You may use deficient knowledge, readiness for enhanced knowledge, risk for aspiration, ineffective therapeutic regimen management, ineffective self-help management, and non-compliance. This is the end of the slideshow.